Hey everybody, it's Andrew. Welcome back to my PTA video. So today I'm going to be going over how to properly put on and take off and care for your knee brace. So why do you need a knee brace? Well, more than likely you've just had an ACL injury, something like that. So this is very, very good and used in those situations to basically keep your knee in extension. And what I mean by extension is it's basically as it sounds. So if my knee's right here, I'm going to extend out. So this would be extension of my knee. And this brace prevents flexion, which is that right there. That is flexion. So with this brace, it'll basically lock you into extension. And then as well, it has these little beams on the side. You can kind of see if I move the strap out of the way. It's got these big beams down the side, and that'll help with medial and lateral movements as well. So if you can see here, these numbers, these are basically presets that you can choose numbers based on, like, maybe your PT's giving you specific guidelines on where to be at. Maybe you're progressing through your treatments or whatever. Right now I have it set at 0 extension, because that's what I wanted at. And then for flexion, I have it open. So that's basically where it'll rotate if I lock it out. I'll show you how to do that a little bit later. But one of the precautions with this, you need to be weight bearing. You need to be a weight bearing status to use this, as well as your knee needs to be in full extension. So if it's not, it's going to be weird, and it can cause contractures, which is a shortening of your muscle. And we don't want that. So you need to be weight bearing, and the knee needs to be in full extension. So care for this is pretty simple. Just Lysol, Febreze, some sort of fabric refreshener or something like that will do plenty good. That's basically just to prevent it from stinking and accumulating germs and a bunch of gunk that you don't want. So for putting it on, it's pretty easy. I've already unclipped these here. As you can see, there's clips on each of these little slots here. So what I recommend is actually I've gone ahead and done it, but to loosen up these straps as much as you can. So there's actually a little bit of Velcro here, and I'll show you that we use these to adjust, but this is actually what will tighten up your brace. So what I have done is I basically just loosened it up all the way so that I have the most amount of room possible to put this on. So it's easier to go ahead and just loosen everything up, go ahead and clip in, and then tighten everything. It makes it a lot easier. And then once you have it adjusted, then you can just clip it in and you don't have to worry about it anymore. So I'll kind of demonstrate that right now. So as I said, I basically loosened everything up all the way, and it's open now. So I'm basically going to put my knee in. And with these, you want to make sure this is right on the fulcrum, so where your knee is bending. You want to try to put these as close to it as possible. There's actually a little circle on this, and that's basically right in the middle of your knee. So I'm going to put this on real fast. So it's right there on the middle of my knee. And all I'm going to do from here is I'm just going to take these little clips, clip them in. And like I said, they're all the way loosened just because it's a lot easier to put on if they're all the way loosened. So I'm clipped in now. So now what I'm going to do is make sure this is nice and centered on my knee. And then I'm going to take these straps here, and I'm basically just going to tighten them up. So a couple things to look out for that I can discuss while I'm doing this. You want to be on the lookout for skin changes. So I have a video on it. It's basically how to do skin assessment. It's called a blanch and capillary refill. So I'll link that video down in the description so you can go and check that out if you don't have no idea what I'm talking about. As well as some things why you might want to call your doctor, for instance. So other than, a weird abnormal skin test, something that you might want to be on the lookout for is any new pain. So I just tore my ACL, right? So my foot shouldn't be hurting. So if I get some weird tingling or numbness or any sort of pain that isn't associated with the injury, go ahead and call the doctor, call your PT, because those are abnormal findings. So any sort of tingling, sharp shooting pain, numbness, anything like that, as well as the skin assessment test that I alluded to earlier. If those are weird, definitely call your PT and follow up with them. So I've got my brace on here, and I'm just going to kind of go over kind of how to use it. So on the side here, I had shown those little clips earlier, so it's basically set into open for flexion, and extension set at 0, which this brace is preventing me from flexing my knee, which is what we want in this case. However, if say you're doing your PT exercises at home, but you can't take your brace off, what you can do is on the side here, there's actually little knobs with like little black like buttons that you press in. So if you press both of those in, there's one on the other side as well. If you press those in and pull those out, you're actually able to fully flex your knee. So it's very, very useful in the case of home exercise programs. And then to get it back in, so I'm pulled back, and you can let them go. It's not going to slide back. But to get back, there's little numbers here, and you put it back in 0. So press the button in and slide it back into place. Do the same for the other side. And then we're locked. So I showed you how to put it on, kind of take care of it, some of the things to look out for. Now, all you have to do really is to take it off. So it's really simple. Once you've got the straps adjusted, all you have to do is just unclip it. So easier said than done. Well, unclip, and that's it. And the brace comes off. So let me know what you guys think in the comments. Bye.